Hi, my name is Emily Mascarelli, and the question I am asking today is what is causing the ancestors of victims of traumatic events to still feel the effects to this day? Why do ancestors of those who suffered through Great Famine, such as the Irish potato famine, tend to carry more weight than the average person and be at higher risk of obesity? Why are ancestors of genocide victims, such as Holocaust victims, tend to have greater rates of mental illness than those whose family members did not go through any traumatic events? Can it be explained by social science, neuroscience, or a mix of the two practices? Is it a chemical effect that started taking place before they were even in utero, or something instilled into the children by their parents? It's a classic case of nature versus nurture. In the case of Holocaust survivors, it has been proven that their FKBP5 intron 7, which is responsible for anxiety levels, releases more methylation in the bloodstream. But what is truly fascinating is that the FKBP5 intron 7 is also mutated in the children of survivors, but releases less methylation than the average person, meaning hypothetically the anxiety levels should be lower. But as shown in many instances, the levels of mental illness are still higher than the average person. So the gene is in fact mutated, even if not in the way we intended. So we still have no clear and definitive answer. It has also been shown that the ancestors of those who survived famines have a unique disadvantage called the FTO gene that caused them to carry more weight than the average person because their bodies became so adjusted to surviving on such little food. There is also another possible explanation for this that focuses more on the social science side of these conditions. When a caregiver is struggling with mental illness, their actions could rough off an impressionable child, giving the children similar traits and issues to themselves. For a hypothetical, if a child is raised by a parent who is struck by famine, then we can expect that parent to always be hyper-conscious about the amount of food that is in their house, and always making sure that the child is well fed, even overfeeding them to ensure that the child did not suffer through what the parent did. These factors can also be a cause of why children's traits help the parents survive through their life. The true cause of this is believed to be dialysis stress model. This model suggests that stress and disorders can be triggered by both predisposition along with events that can act as a catalyst. This makes disorders become present. For example, if a child is born from a Holocaust survivor that suffers with PTSD and depression, the child is now predisposed to those disorders. The catalyst would be having to watch a parent suffer through mental illness along with any other inherent problems that come along with being alive, triggering the predetermined response to adversity, which would be going into depressive episode.